Students, welcome back. Today's topic of discussion is gastric adenocarcinoma. That is one of the most important topics in the GIT and stomach. Now, the word gastric means stomach, and adenocarcinoma means gland, and carcinoma means cancer, malignant cancer. Okay. Now, glandular adenocarcinoma arises mainly from columnar epithelium, as the normal lining of stomach is columnar epithelium. There are other gastric cancers as well, which are lymphoma that arise from lymphocytes, and that is termed as maltoma, that is mucus associated lymphoid tissue. And carcinoid tumor arises from the G cells, that are actually the neuroendocrine cells that normally line the epithelium of the stomach. Other one is the leiomyosarcoma that arises from smooth muscles. Now, these are few cancers that are present in the stomach, that may be present in the stomach. So, the most common among these, the most common is the adenocarcinoma. So, let's just discuss the adenocarcinoma in detail. Now, before discussing that, we should learn the normal anatomy of the stomach, that it is 4 parts: the cardia, fundus, body, and the pyloric antrum. Now, the whole stomach is lined by the columnar epithelium, and after this in the mucosa, and then comes the submucosa, and then comes the adventitia. So, the cells that are lining the epithelium is foveolar cells that secrete the mucus, which means that is the protective layer against all the acidity and all the content bolus containing food that is so in this way the stomach is protected by this layer. The other cell is the parietal cell that secrete HCl, and the second function is it maintains the acid pH. Third one is the chief cell that secretes pepsinogen that is converted into pepsin, and pepsin does what? It degrades the protein content. G cell and helps in digestion. G cells are actually the neuroendocrine cells that secrete the gastrin hormone, and also it causes the stimulation of parietal cells. So, G cell got 2 functions: gastrin hormone release and stimulation of parietal cells. This was the basic anatomy you should be knowing. Now, coming to the next adenocarcinoma in detail. Now, adenocarcinoma occurs in 90% of the cases. That is the most common cancer of stomach. So, according to Lauren classification, Lauren was a scientist who classified this cancer into 2 types, further 2 types: intestinal and diffuse. Now, let's discuss it. Intestinal adenocarcinoma is the most common type, and it is caused by it has a strong association with the H. pylori, which is Helicobacter pylori gram-negative bacteria, Epstein-Barr virus, and there are certain mutations, that is APC gene and beta-catenin mutation. Okay. What happens after these causes is that they causes changes in the epithelium, and there occurs chronic gastritis leading to the metaplasia and dysplasia, which means that the epithelium of the stomach changes into the that starts resembling the intestinal epithelium. That is why it is named as intestinal adenocarcinoma. Now, what is the morphology of the intestinal carcinoma is that it is irregular, large, and it is with heaped edges, which means that the cancer in intestinal type, the cancer will appear. What will be seen on from the naked eyes will be a bulky type tumor, cohesive fronts, and exophytic mass. I can show you in the medium Robbins that they have told us the pictures is that this one. Okay, this is the intestinal type adenocarcinoma. This is the raised as a central ulceration, and with the heaped up borders. These are all heaped up borders, and this is the bulky exophytic mass. Now come to the diffuse part of the gastric cancer, that it affects any part of the stomach. Intestinal was mainly affecting the lesser curvature. You can take the screenshot of these notes as well so that you have a better grip over the topic. Now, okay, what happens in diffuse type is that there is mutation in the CDH1 gene mutation, which means that CDH1 gene encodes a protein that is E-cadherin. What is the function of E-cadherin? Is sticking of the cells and control of the cell cycles, which means the cells in the stomach that are adherent to each other are mainly controlled by the E-cadherin protein, and mutation to this will lead to the multiplication and uncontrolled division of the cells, which means leading to the cancer. And morphologically it appears as infiltrative, and there is a generation of desmoplastic response, which means that cell lose their shape, orientation and all the size, and they will be completely disfigured, which means desmoplasia. Okay, coming to the next point is the Linitis plastica. What is it? The morphology is Linitis plastica in diffuse type, which means that it starts resembling Linitis plastica means leather bottle. That means the diffuse type of cancer will start resembling the it will start resembling like a leather bottle, which means what does that mean in detail is there will be rugal flattening. Now we all know that there in stomach there are rugae, which means that like this. There are rugae. There will be total flattening of the rugae like this. These are gastric pits. Okay, these are so there will be rugal flattening, and there will be rigid wall of the stomach because of the infiltration, because all the cancer invading this is the mucosa, right? This is the mucosa, lamina propria and other muscularis layer. Beneath this is the submucosa. So the cancer cells will start invading the submucosal layer, and it will result in rigid wall, and it will start resemble like a leather bottle. So it is termed as Linitis plastica. This is a very important feature and point in the diffuse type. Now histologically what is seen is that there are signet ring cells, which what is the meaning of signet ring cells? Which means the cell in this cell there is a huge cytoplasm pushing the nucleus to the periphery, and in the cytoplasm there are giant vacuoles can be seen. This is all about diffuse and intestinal type. Now let discuss the symptoms of this cancer. What will be the symptoms? Obviously the stomach is present in the epigastrium, so there will be epigastric pain as nothing is digested and properly. So there will be nausea, vomiting, dyspepsia because of uncontrolled cells and other. There will be weight loss, anorexia, melena. Melena is the, what is the meaning of melena? That is blood in stools. If it is occurring in the upper GIT, which means that there will be melena, so there will be brown, coffee colored or black tarry stools. And if there is hematochezia, the word is hematochezia, which means that fresh blood in stools, that is due to lower GI bleed. This is a very important point. So there will be melena because of the gastric ulceration leading to bleeding. Similarly, there could be hematemesis, which means that blood in the vomitus. So these are the symptoms. On examination, what is seen is, now when the person comes with the gastric, these signs and symptoms on examination, what a person is supposed to do is, what a doctor is supposed to do is virtues. He will see the virtues nodes that are present normally in the neck area. They will be enlarged. Now this is termed as Troyer's sign. There will be you will assess the Sister Mary Joseph nodules, which means that are not normally present. There is a sign of mutation and metastasis, that is enlarged umbilical nodes. So these are the signs and symptoms, and on examination the what is seen. Now come to the complications. Complications is all about it includes metastasis, which means that peritoneum It metastasizes to the peritoneum, liver, virtues node that are already discussed, that causes Troyer's sign, umbilicus that causes sister Mary Joseph nodules. Similarly, the second complication is the paraneoplastic syndrome. Now, what is the paraneoplastic syndrome? Which means that tumor resembles the original gland but is not present in its own location. If I give an example, is that suppose cells of thyroid gland that are present in the adrenal gland, they will start secreting TSH or similarly other hormones. Similarly, lung small cell carcinoma is the most important example. It will start secreting the hormones that are not originated from the lung, but it is secreted from the lung cells. Okay, now come to the second point is paraneoplastic syndrome leads to the lesser Trellet sign, that means seborrheic keratosis. Now the cancer cells in the stomach start producing growth factors. Growth factors stimulate the keratinocytes. The keratinocytes causes the keratosis, and on skin seborrheic keratosis can be seen. Third complication that it causes the polyarthritis nodosa. Polyarthritis nodosa is the vasculitis or inflammation of the medium cell arteries, leading to that all the medium arteries that are involved in our body will cause dysfunction in their respective organs. For example, in the heart they will cause myocardial ischemia, and in the liver, in the kidney they will cause renal failure. Fourth one is the Trousseau sign, that is the most important sign, that cancer cells will stimulate the tissue factor and it will start a coagulation cascade leading to the thrombosis. Thrombosis, there is migratory thrombosis, that which means that all the veins will be clogged up with the clots or thrombosis. Okay, fifth one is the stricture. Why stricture is formed? That if we see the picture of the gastric gland, that is, this is the picture. So if we have at this point there is a esophageal cardiac junction. If we have cancer at this point, there will be growth of cells here, and a stricture and adhesion of these structures will occur, and there will be no passing or no space for passing of the bolus or the food and entering into it. So there will be stricture, and this is one of the most complications of the gastric carcinoma, and it will resemble eclasia cardia. I hope you are familiar with this term. So it is also called as pseudoeclasia syndrome. Now come to we have discussed all the complications, sign and symptoms. Now to confirm the diagnosis, we will do investigations. What will be in the investigations? That is the barium swallow. Now barium swallow, which means that we have a contrast and fluorescence material that is swallowed, and we will see the shadow if there is any structure or changes in the normal structure of the stomach. Second, the most common and the most sensitive test is the endoscopy. On endoscopy, we see the ulcerations or any other disarrangement. Third one is the CT abdomen. Now, this is all about gastric adenocarcinoma and other carcinomas related to the stomach. I hope you liked the video. Please don't forget to subscribe my channel and hit the bell icon. Do comment and share, like, subscribe. Thank you.